Hello, this is Bill from Mission Veterinary Clinic. Today I'd like to talk to you about the electronic whiteboard. Presently we use a three-part system. We use the computer system to charge people in and out, make our estimates, and to charge the clients out. We use a oil board as a whiteboard on the wall, which shows us our treatments, patient's name, status, information we want to write down. And then we use a clipboard to actually mark the treatments. And then we have to manually enter those treatments in and scan those papers. So I'd like to consolidate a lot of that work and just make it all in the computer and have an electronic whiteboard. Now, if you have not gone to the Idexx Learning Center and watched the Cornerstone Basic Whiteboard video, getting on board with the electronic whiteboard, please go do that now. It's about 30 minutes. And the video I'm making does not replace that video. The Cornerstone video goes in way more detail on how the item works. Okay, so if you've not seen it, please go watch it first. Now, I'm going to go ahead and minimize that and proceed. And what I'm going to do is I'm just going to go through a basic workflow as if a patient came into the hospital. And we're going to say that Gaston here came in today and has parvo. And we're going to go through a treatment workflow for Gaston. I'm going to right click on his name and make an estimate because that's the first thing we would do. I am going to create a parvo bundle. That is the fastest way. If you're not using bundles to make your estimates, you should consider it. We'll make Dr. Lee the provider. And I'm going through this part really quick because you should already be familiar with this and doing this several times a day. We're going to save and continue. We don't need to print, and we're going to finalize this estimate. Now, do we want to transfer items to the patient visit list? Yes, we do. We have to do that. So we're going to transfer the items to the patient visit list. Depends on how you want to do it now. If you normally process. If you normally continue. Okay, we're going to continue right now because this isn't a real patient. If I go over to the whiteboard right now, Gaston will not be on the whiteboard. Okay, let's go take a look. In the upper left-hand corner, the fourth icon in is the stethoscope, which is the whiteboard. Fourth icon in. If that icon is not there for you, please tell me and I will make sure it's added to your favorites. And we have Fugo there, and Fugo is all grayed out because Fugo's already gone home, but Gaston is not. So, how we put Gaston on the whiteboard is we right-click on Gaston's name. We go to check-in. On the right-hand side, halfway down, see reason for visit. We take the radio button. We switch it from outpatient to inpatient. We take the status in the drop-down menu and switch that to inpatient. Now here, critical, we can choose to click. If we do, it puts a red heart next to Gaston's name, letting us know he is a critical patient. Alert notes, we can put any notes we want here. And they will appear on the right-hand side of the whiteboard, letting us know. And let's just put that Gaston is cage aggressive. And we're going to check in. Staff ID is required. So here I need staff ID. That is going to be the doctor's ID. Checked in is going to be mine. I'm checking Gaston in. I don't need to print. Now Gaston is checked in and he's on the whiteboard. Let's go look. So we go to upper left-hand corner, the fourth icon in, we see that stethoscope. I'm going to click on that. There's Gaston. His name is yellow because he's on the whiteboard, but no treatments have been created. Okay. We see on the right-hand side that he's cage aggressive. We did not mark critical, so there's no red heart next to the inpatient. If his name was black, that would indicate that he has treatments, but none are overdue. If his name was red, that would indicate that he has overdue treatments. So, there are 3 pages we need to understand in the computer to manage the whiteboard. One is the whiteboard itself, which we are looking at. The next is patient orders. That is where you create the treatment plan for the patient. And then patient treatments, and that is where you perform the treatments. So we need to create some orders. We need to create some treatments for this patient. So I'm going to left click on patient orders. I'm going to go here to discharge. This is how many days we expect Gaston to go home. And we need to modify this date to whatever date we expect him to go home. I'm just going to pretend we're going to expect him to go home on the 28th. We need to make sure that we have the correct doctor. Then we're going to go over here to the PVL on the right-hand side, and we're going to import some treatments. So, as I go through this, I'm going to left-click on any treatments I want to import. I do not want to import injections. Okay? This is important. If I import injections and delete them, it will remove this from the PVL and the invoice and not charge for injections. Okay? So I'm going to leave that there. And we want to put the actual injections manually that we're going to give into the whiteboard. I'm going to click on the blood work, click on the parvo test, click on the fecal, the IV catheter, the fluids, all of this we need to do. I don't need to do extension or hospitalization bundle. Okay, everything else looks good. All right, and now I'm going to click order. It's going to put all these items on the whiteboard for me. Now I'm going to spend a little time and go through and explain them. The blood panel, the item description, the quantity, the billing, okay, one line each time, category, frequency, this you need to pay attention to, okay. We're only going to run this blood panel one time, makes sense. Note, required when not performed. That also makes sense. If for some reason we don't do this blood panel, you're going to need to make a note on why it wasn't done. Okay, this checkbox would be for vital signs. Okay. PRN would be as needed. Dose now. This box is a little glitchy, and I don't understand why it lets me check it sometimes and why it doesn't. I'm still working on that. Go to the next. Oh, the start date and the start time. Okay. And then the duration. How long are we going to do this treatment for? Okay. The parvo test, the fecal, those are all basically the same until we get to IV fluid therapy. That is continuous. Now we need to add some items in, like our injections. Okay? And I can also put little notes on the blue. So under IV fluid therapy, I'm going to put 20 mLs per hour, 3 cc's vitamin B in bag. Okay? I'm going to go on to my next item, and I'm going to create Polyflex. Now, I need to put the dosage of Polyflex, the actual dosage. So I'm going to say this pet's going to get 1.25 cc's. Okay? Twice a day, that's fine. Once again, required when we don't do it. And then we should probably give some clindamycin. Once again, the actual dosage we're giving, let's say we're giving 2 cc's, and I'm not trying to get right dosages for this patient, but we are putting in the dosages we're giving, and we're going to give this twice a day. Require a note when it's not performed. Most items are going to require a note when not performed. And let's do Reglan. And whatever. For some reason, the doctor only wants half a cc given of Reglan, and that's 3 times a day. Looks pretty good. Now let's add some housekeeping items. These are items basically we do not charge for, and they're called whiteboard items. So I'm going to double click here on the little white, the next line. I'm going to go to classifications, and I'm going to enter whiteboard, and I'm going to open this up. Call the client. Yes. I want this client called, well, we don't need to call him 3 times. Let's call him twice a day. And I want a note is required when not completed. Over here, you left, you see the dollar with the X? It means we're not charging for that. Whiteboard item. And no, we're parvos, so we're not going to fill the water. But we are going to monitor the vomiting, diarrhea, and urine. I want that checked every 4 hours. Okay, note always required. I want always required on cage monitoring because I want to make sure everyone on every patient logs every defecation, every urination, and every vomit. Okay, even if the animal is healthy. And let's go on. What other whiteboard items would make sense for this patient? Oops. IV catheter patency check. So we want to check that IV catheter twice a day to make sure it's working. And he is going to be NPO, so let's put that in there. Okay, I think we're looking pretty good for this patient. You know what? The vitals. Let's add in checking this patient's vitals. Nine twice a day. That means twice a day at 9 o'clock. Having said that, BID up here would also be at 9 and 9 p.m. That's when there's preset for. So that looks like a good treatment plan for me. We're going to click OK, and now it's transferring that information to the whiteboard. So here you go. You can see Gaston. All the light blue items, those are continuous items. Okay? The darker blue items, those are items that are not continuous. So we need to do some treatments now on Gaston. It's 2 o'clock. 2 o'clock's the yellow. These treatments are due. Let's go ahead and do them. I want to right-click on his name and go to Patient Treatments because that's how we do the treatments. Now, I'm going to suggest that you mark you do the treatments before you do them because I don't want you to give an injection, run off to help somebody else, forget to mark the treatment, and then a different technician comes along and does the treatment a second time. Okay, so I want you to mark the treatments before you do them. Draw them up, mark them, then give them. So we're going to go to the very first thing, which is the blood panel, and I'm going to left click on the scheduled at 2 p.m. and I'm going to double click. Now at the bottom it opens up, vet scan comprehensive. I'm going to mark that I ran it, put in my user ID, mark completed. Come over here, I'm going to use the completed time, so I want the actual time I did this, and I'm going to click OK. And now it is green, it's marked completed. Now let's say I wanted these treatments to go a little faster, the computer part that is. I would click on the one, hold down the shift, continue to go through with the shift held down, clicking on individual items. Once they were all clicked, I would right click, go to Process Selected Treatments, put in my password, mark completed, come over here to display completed time, so it's the actual time that I did, and I'm going to click OK. It automatically just goes to the next item. The next item is fecal, automatically sets completed. I can just click OK again. Automatically goes to IV catheter. I can just click OK again. It wants a note. It's going to automatically be processed a note for IV catheter. So I'm going to put in 20 gauge right front leg. Click OK. And now it's gone on to IV fluid therapy. Click OK. Clean cage. I know clean cages are going to require a note. Okay, so I'm just going to click in here to put the note. I'm going to put no vomit, diarrhea, urine. Okay, and that's basically under clean cage. I want to see what happened, whether it's no vomit, diarrhea, or there was vomit, there was diarrhea, there was urine, there was bloody diarrhea. What was there? Please mark it here every time. I'm going to click OK. NPO. Just click OK. That's reminding me we're NPO. And my treatments are all done. Okay. What this did not show me was my injections. Okay. And I want to perform some of those injections. I am going to go forward in time to perform those so we can see how they transfer. Now, it is possible, let's say the doctor wanted you to give we're going home early. We're going home at 4 o'clock and the injections aren't scheduled till 9 and the doctor's like, give those injections before we go home. I don't care, it's 4 o'clock. You could go ahead in time and click on these 2 injections. Oop. Click on these 2 injections. Okay, I'm doing one at a time. My team viewer is acting up. Oh, there we go. Right click, process selected treatments, put in my password, completed. I'm going to use the display using completed time, especially since we're giving it so much earlier. You don't want the client to order records and have them say it was given at 9 p.m. when the animal went home at 3 p.m. Now, everything is completed. Let's log back out. And as you can see, everything is green. So that's how you process treatments. Now the next step is, what if we wanted to send Gaston home now? First thing we'd have to do is right click and go to patient orders. We'd have to take his status and change it to ready to go home, ready for doctor to discharge, or ready for tech to discharge. It has to be changed to one of those before we do anything else. Very important. Click there, click OK. Now we can go to the Gaston's PVL, so we're going to go to the patient visit list. We see those injections I gave. See all the stethoscope? That shows you all the items that transferred from the whiteboard. Okay, but now we have a decision to make. The decision basically has to do with injections. If we make a mistake with the whiteboard, it's probably going to be with injections. So we either need to come up here to injections and delete this and zero it out, or come down here and delete the prices for these injections. Okay? But you've got to make sure you charge the injections properly. This is my main concern in using the whiteboard, is not double charging or not charging at all for the injections. The other item is our pharmacy to go home. So we're going to need to come up here to pharmacy, and we're going to need to control delete the pharmacy and then put in the actual meds that we're sending home. In this case, let's send home some amoxicillin, 250. I don't want to actually create a label. And let's send home some Reglan, 10 milligram. Okay, cancel, because I don't want to create a label. And then I'm going to come up here to my antibiotic injections, and I'm just going to change the prices to 0, and I'm going to leave the injections up here. I could do either one. I just need to watch my estimate, make sure it matches. Whether I'm going to leave the injection here and 0 those out, or I'm going to delete the injection here and leave them down here. I hope that makes sense. That's my main concern with using this whiteboard, are the injections and how we charge for them. Now, we're all set. Time to charge the client out. I'm going to click Invoice. I'm going to click Post. No, I'm not going to process the image or the lab requests or any of this stuff just because we're not, this isn't a real client. I'm going to remove applying payments and just check out the patient. Click OK. There. Now, if we go look at Gaston, has gone home. Oops. There is his invoice. He shows having a balance of $2,400 because I did not accept a payment. Go back to the whiteboard. He's still on there. He will go, I can actually click remove from whiteboard if I want, or let's just try refreshing. If I refreshed, he's gone. So the whiteboard refreshes about every 2 to 3 minutes. Now, by being grayed out, this means he's left the hospital. He will disappear shortly. If I wanted to remove him, I could right click and go remove from whiteboard now that he's grayed out. It's going to make me wait. In a few minutes, it will disappear. I hope that video was helpful. Thank you very much.